Welcome to the University of Washington Department of Emergency Medicine. My name is Susan Stern, and I am the chair of the department. This is a really exciting time of year. It's always fun and invigorating to meet the wonderful residency candidates and really to share with you the sense of our pride and commitment to our program and why we think this is a really special and unique place to train. I just want to take a few moments to share with you a little bit about our department and the big picture view of the residency program. I'll talk a little bit about our mission, our vision and goals for the program, as well as our goals for and our commitment to you as future trainees. Dr. Sarah Greenberger, our program director, will be speaking in much more depth and separately about the curriculum, both clinical and didactic, as well as the many other experiential opportunities that our program offers. As you peruse our website and hopefully review the videos and all of the other informational resources that we have developed, and through the interview process, speaking to our faculty and residents, we hope that you will come away with a really strong sense of who we are, our values, and the many varied and exceptional opportunities that the program provides to our trainees. So let's get started. Let's start by talking a little bit about the mission of our program. The mission and goals of the University of Washington Emergency Medicine program are to train outstanding emergency physicians, those who can practice anywhere and see anyone, whether that be in a rural setting, inner city, county, academic health center, community, under-resourced international setting, you name it. We also aim to train and develop the future leaders of our specialty. Those are the people who will be the change makers. Perhaps they will lead the way and change how we deliver medical education. Maybe that's someone who will lead in policy or lead the way in resuscitation science or in opiate use disorder research, in EMS, or lead within their community hospital. Those are the people who will focus their passion in a manner that really creates impact even outside of the clinical arena. And then last on this list, but certainly not least, we aim to instill values or reinforce values of ethical behavior, professionalism, and advocacy for all patients. Now, I'm going to talk a bit more about each of these goals, first the top two, and then the last one. Again, they are equally important. So let me first comment on the top two: training outstanding emergency physicians who can go anywhere and see anyone, and developing the future leaders of our specialty. The overall mission of UW Medicine is to improve the health of the public. Now, that's a pretty broad mission. So we ask ourselves, how can we in the Department of Emergency Medicine, as academic emergency physicians, best contribute to that mission? Well, there are a number of ways. The first is the obvious, through the delivery of outstanding care within our own emergency departments. And I'm biased, but of course, I think that we do that here, and we do that really well. We have an amazing group of faculty and residents who strive for excellence in all they do. But the way we can actually impact many more lives, locally, regionally, nationally, and even globally, is through education and leadership development well beyond the walls of the emergency department. By training emergency physicians who will go out and deliver outstanding emergency care to all geographic locations, that's a really great step forward in creating equity with regard to emergency care. And the number of patients we can impact through that is tremendous. Hence, the first goal of training those outstanding emergency physicians who can really go anywhere. Now to the second goal: training and developing the future leaders of our specialty. By developing, by supporting, by giving the foundational skills to those people who aspire to really go out and make change, to make cardiac arrest resuscitation better and do that discovery, or maybe related to sepsis or opiate use disorder or technology development. Again, really to that person who's going to lead in a manner even outside of the clinical arena. Maybe they're going to advance graduate medical education or undergraduate medical education, so that people, our students, our trainees become better doctors, more whole doctors. That's the way we can really shape the future of emergency care and impact an infinite number of lives across all communities. This is how we can more effectively and broadly contribute to that mission of improving the health of the public. In this way, we are shaping the future of emergency care, and our impact is wide-ranging. Now, you may ask, well, why is that so important to you? Why not just train great physicians? Well, we actually see all of this as an obligation and our real responsibility. We are privileged to work and practice our profession, emergency medicine, at a major academic health center with a tremendous amount of resources. It's one of the finest academic health centers in the world. And given that we have all of these resources at our fingertips, we see this as our responsibility to simply put it, make the world a better place, to put those resources to use towards making emergency care better for all patients, our current population of patients, future patients, and all regardless of geography. That's why we take this so seriously and so much to heart. To that last bullet point, to instill values of ethical behavior, professionalism, and advocacy for all patients. Again, it's last on the list, but it's by no means least. As emergency physicians, hopefully you know this already, we must advocate for our patients. We must be the best advocates for our patients and for all patients who walk through those emergency department doors. When a patient walks through those front doors of the emergency department, regardless of their station in life, they are at a vulnerable moment in their life. No one wants to come to the emergency department. They are either here because of an event that just occurred, or often, unfortunately, because of their circumstances in life that have, been so challenging and have driven them there. An important part of our role, and really core to our profession, is to advocate for that patient. That is part of what makes an outstanding emergency physician. I'm biased in that I do believe that we are the best advocates for our patients as emergency physicians. We do it better than anyone else. And you really can't be a good and outstanding emergency physician if you're not an effective advocate for all patients and committed to that role. Our faculty, our residents, and UW Medicine as a whole, in particular Harborview Medical Center, where you will spend most of your time, are wholly dedicated to this mission, that of advocating and serving the most vulnerable. And this is in part what makes this such a special place to train and work. And we will talk a little bit more about that in a few moments. So let's move on and talk a bit about our goals and commitment to you as trainees should you come here. Consistent with our mission, our goals, and commitment to you are, first, you will leave here an outstanding physician with the knowledge and skills to practice anywhere and to see anyone. You will deliver excellence emergency care regardless of where you are. You will have experienced while you're here a breadth of opportunities across a wide variety of clinical settings, and you'll be able to make an informed decision about where and how you want to practice. Second, we will work with you individually to ensure that you have the tools to reach your professional goals and your full potential, even outside of the clinical arena. You will have the time and mentorship to develop the tools and foundational skills for your very personal aspirations, whether it's in education, research, an area of clinical medicine, advocacy, administration, whatever that may be. You will have the opportunity and be prepared to be the change makers and lead in your area of passion should you choose to go in that direction. And finally, you will develop your leadership skills. You will leave this program with the ability to lead both in the emergency department as well as in the area of your interest, your niche, or your non-clinical focus. To be an outstanding emergency physician, you must have great leadership skills. Just think about it. When you walk into that emergency department, the team is looking at you to lead the department, whether it's in regard to a mass casualty incident that occurs on that day, or it's just a busy day where the resources are tremendously stretched, or even at the head of the bed at an individual major resuscitation. You are running an interdisciplinary, interprofessional team of nurses and MAs, radiology technicians, physicians from other disciplines as well. And in order to ensure the best care for any one patient, you need to make sure that your team is functioning at the highest level possible. And in order to do that, you've got to be a good leader. And so this is our commitment to you and our goals for you once you graduate. Now, some might say these are pretty big and lofty goals. You may be wondering, well, how do we accomplish these? You may be wondering, how do we accomplish these goals? Well, speaking generally, or from a 50,000-foot view, we do so first by providing a broad-based but very in-depth 4-year curriculum that we think is truly unmatched. And second, we do so through our unique career development pathway program. This is truly one of the gems or jewels of our program. This program provides trainees the opportunity for career exploration and self-discovery. It allows them to dedicate structured time with close mentorship to test the waters and develop advanced and special niche-related skills in areas of interest and potential passion. And again, this is all done with close and individual mentorship and guidance. The goal of this is to help our trainees begin to realize their individual and, again, very personal aspirations, or at least give them the tools to get started. I would encourage you to review the separate video that describes our career development pathway in much more depth. Now, candidates often ask, why 4 years? Well, let me just say, it is not about the 4th year, but rather it is about providing an in-depth clinical curriculum throughout the 4 years, while also allowing our trainees to do this self-discovery, this career exploration and career development. We could not possibly do this in 3 years. It is all stretched out over that 4-year period. So that's the big picture. Now let's talk a bit about the individual institutions where you will spend much of your time and receive most of your training so that we can meet these goals. These are the resources, what I'm going to introduce to you now are the resources that we are able to take advantage of in order to reach these goals and to provide this broad-based experience, both clinically and even outside of the clinical arena, and that allows you to really explore your unique career aspirations and develop some great opportunities. So should you decide to come to our program, you would be a member of the UW Medicine family, so to speak. And UW Medicine is really an umbrella organization comprised of 8 entities. First of all, the University of Washington School of Medicine, 4 hospitals, which are Harborview Medical Center, the University of Washington Medical Center, Valley Medical Center, and Northwest Hospital. You'll work at Harborview. You'll work at the University of Washington Medical Center and Valley. You will not work at Northwest. That is a community hospital a little bit north of here. You'll receive patients from them and maybe transfer patients to them, but you won't work there. Airlift Northwest is another part of UW Medicine. That's the Air Medical Transport Program, and they'll have a big influence and an important part of your education. The University Neighborhood Clinics. This is just the vast clinic system within UW Medicine from which you will send patients and obviously receive patients. And then UW Physicians, which is really just a faculty group practice and really represents the wonderful faculty from which you will learn and partner. We also have some very important and close working relationships and collaborations. One of those is with Seattle and King County Medic One, which is the ground EMS program, Seattle Children's Hospital, where you will spend a significant amount of your time. And then Fred Hutchinson Cancer Center, where, of course, you won't work there, but you will receive patients from there and you will send patients to the Fred Hutchinson. So this is a network that we are able to tap into to provide an exceptional education and really that broad-based education. Let me talk about a little bit about each of these entities, or at least those entities that will most impact your education and your life while you're here. The first thing that I'm going to mention is the University of Washington School of Medicine, which truly is important and does impact you. And now, many of you may be saying, wait, why is that important? I've been there, done that. I'm finishing medical school, don't want to do it again. Am I in the right place? Yes, you are on the right plane, going to the right place. But the School of Medicine in which you will train and practice that's affiliated with your program will absolutely impact your education. And I'm going to explain and make my case in a moment. But first, I'm going to talk a little bit about the UW School of Medicine. So the UW School of Medicine is top ranked with regard to education and the training it provides both to students and trainees, as well as in research. It's unique in the sense that it serves such a very broad region. It serves what we call, it has a long-standing relationship and serves the states of Washington, Wyoming, Alaska, Montana, and Idaho, what we lovingly call the whammy region. And in essence, there are dedicated seats within the School of Medicine for these 5 states. And by virtue of that, the School of Medicine represents essentially a quarter of the land mass of the United States. This is very unique. Now, not surprisingly, with that in mind, the class size is fairly big at approximately 270 students per class. But what it also means is that we are attracting really the best and the brightest students from a really broad range, a wonderfully diverse group of students who come from all walks of life, whether it's living in the villages of Alaska, in Anchorage, in Fairbanks, over in Forks on the peninsula of Washington State, in Spokane, in the inner city of Seattle, in the surrounding communities, from the farms of Idaho, Montana, Wyoming, from ranches, you name it. The students come from a really broad range of backgrounds and geography. So truly a diverse, wonderful group of students. Now, back to making my case for the importance or impact of the School of Medicine to which your program is affiliated. First, you may not realize this, but as a student, you had a very positive influence on the residents with whom you worked. You made them better physicians and really contributed significantly to their training and development, regardless of their specialty. And I say that not just because you might have done some scut work, as we used to call it, not just because you took on some of the patient load, but because they were your teachers. Let's face it, as students, you receive much of your education from the residents. There are very few specialties that have 24/7 attending presence within the hospital. And by virtue of them teaching you, they became much better doctors. There's nothing better to reinforce your knowledge when you have the opportunity to teach and educate. So to be exposed and have access to an eager and bright group of medical students for whom you, as a trainee, will be responsible for teaching, but also for supervising, that's really an incredible opportunity. It's a great growth opportunity. And the UW students, as you will see, are, as I mentioned, incredible. Emergency medicine is a required fourth-year rotation here, so you will be teaching them, and they will push you to teach. They will make you dig deep to explain the why. You will learn how to teach psychomotor skills and procedures. You'll learn how to give constructive feedback, and you will learn how to deal and teach varied learners. They'll make you better emergency physicians. Some of you may be thinking, maybe it will make me a better doctor, but I really don't want to go into medical education. And that's fine. But you know what? In order to be a really great emergency physician, you actually need to be an effective teacher. Even if you don't want to go into medical education or academics, even if you're in a community practice with no formal learners in the emergency department, you will quickly learn that you actually need to be able to teach. You have to be able to teach the nurses, the MAs, the rest of your team, the EMS providers that deliver patients to your emergency department. Emergency medicine doesn't stay stagnant, as you know, and as an EM attending, your team will look to you to bring them up to date and introduce new protocols, new devices, teach them about new interventions and the why. And most importantly, you're going to need to be able to teach your patients. Now, to assist you in this educator role, we do have a formal curriculum that prepares you and helps build your teaching skills. We certainly prepare you for that, and Dr. Greenberger will get more into that when she's describing the curriculum. A second advantage of being at a top-tiered school of medicine, such as the University of Washington, is that it not only attracts the best and the brightest of students, but it also attracts the best and brightest of all other trainees across all disciplines. Now, of course, I think our trainees in emergency medicine are the best, biased, obviously, though I think I have objective evidence for that. But in any case, whether it's orthopedics, general surgery, OB, critical care, cardiology, the UW trainees truly are exceptional across the board. They're bright, they're caring and dedicated physicians. They're really enthusiastic about teaching, and they've embraced our residents and welcomed our residents on their services, just as we embrace and relish training them. I certainly wouldn't want to send you to an off-service rotation in neurology, cardiology, the trauma ICU, if you were the one that was going to know the most on that service. What would be the point of sending you there? We want you to be trained by the best of the best. And that means that the other trainees in the institution in their disciplines, as well as other faculty throughout the institution. And similarly, a top-tiered school such as the University of Washington also attracts the best and the brightest of faculty. Again, I'm biased. I think our faculty are the best, but there truly are just amazing faculty throughout the institution. You will be taught by and work with those faculty who are creating new knowledge and discovery. They are publishing in the New England Journal of Medicine, in JAMA, in Annals of Emergency Medicine, and Academic Emergency Medicine. You'll be surrounded by people that will challenge you, but at the same time, they will wrap their arms around you and really embrace teaching. And so that's why training at such a top-tiered school of medicine can really make a difference for you and your education. So let's talk about the places where you're going to spend most of your time. We'll start with Harborview Medical Center. Harborview is the safety net hospital for the region. It is a county hospital, though it is fully operated and managed and integrated into the organizational structure of UW Medicine. Harborview has a very specific mission, and that is to care for the community's most vulnerable patients, whether those are the imprisoned, non-English speaking, under-resourced, those with housing instability, food instability, victims of domestic violence or sexual abuse, patients with substance use disorder or mental illness, you name it. Harborview was founded and built from the first brick and mortar in the ground as a safety net hospital. It was actually founded in 1877 and termed a welfare hospital. It moved to its current location and was renamed Harborview in 1931. Of note, Harborview provides more charity care annually than all other hospitals across the state of Washington combined. Think about that. That is tremendous. This is why we're here. This is our mission, and it is such a privilege to work here. Because Harborview was built for this mission and is known for this mission, it is widely embraced by the region and by the community. And at the same time, Harborview has focused its resources and program building on the most vulnerable, on supporting the most vulnerable. It is very deliberately and effectively forged critical relationships with the community. Examples of this commitment and focus include the High Utilizer Program that supports people in crisis through the delivery of flexible and individualized services. The High Utilizer personnel will often go out and meet the patients. We have a very strong social work and case manager program who regularly interface with the community, whether it's with the shelter system, with the outpatient opiate use disorder clinics, or other substance use programs in the community, detox, sobering centers, behavioral health centers, you name it. Harborview also provides primary care for a significant swath of the most vulnerable patients. For example, we provide primary care and support the clinics associated with the shelter system. Now, this commitment to mission is really what makes Harborview such a special place to work, among other things. It's truly a privilege to work in such a mission-driven hospital. If you had even 2 days to spend here, you would see and feel this. It's palpable and easily apparent that everyone who works here, from environmental services all the way to the CEO, not just those in the emergency department, everyone is deeply committed to the most vulnerable and the mission of advocating for the most vulnerable. And really, that truly does make this special. It's important to note that because of this commitment and focus, because of Harborview's history and its close relationship with the community, we're actually more well-resourced than many other safety net hospitals. Don't get me wrong, we do not have unlimited resources, and we can't fix the system, the greater healthcare system. But when you are working at the Harborview ED, you do have the ability to provide support and meet many of the needs of the most vulnerable patients and truly make a difference. You feel like you can have an impact. An example, the person that comes in that's really, truly disorganized, you don't think that they're going to make it to a clinic appointment. They're not going to, maybe they don't have a phone, maybe they just don't have the skills to make that appointment. You can actually give them an appointment in hand when they leave the ED, so they're much more likely to receive that appropriate follow-up care. You can get patients with opiate use disorder on Suboxone and then connect them with an outpatient clinic. You work with a great social work team who helps to make all of this happen. It is not all on you to do this. We are a very integrated team within the department. We obviously have 24/7 social workers in the emergency department. We actually have 2 social workers during 24/7 and 3 social workers during the busiest portion of the day. And I already mentioned the high utilizer program and our case managers. So really a wonderful place to work for that reason. But Harborview is way more than just the safety net hospital. It's actually a center of excellence in a number of other areas. First of all, it is the only level 1 adult and pediatric trauma and burn center for the entire states of Washington, Alaska, and Idaho, and for most of Montana. Now, think about that. Many of you are from cities of the same or comparable size as Seattle, and there may be 2 or even 3 level 1 trauma centers in your city, and with some level 2s and level 3s interspersed, and trauma is going here and there and without much coordination. Well, Washington and this larger region has a very well systematized or coordinated trauma system with some of the best outcomes in the country when you look at the quality improvement data. Now, because we have such a large catchment area and we're in a big city, and Harborview is the only level 1 trauma center, Harborview is one of the top 5 busiest trauma centers in the country based on trauma admissions. We admit to the hospital 6,000 or so trauma patients. That's not who walks through our front door. Many go home, but 6,000 actually get admitted to the hospital. The volume and variety of trauma we see are tremendous. We see penetrating trauma, accidental and non-accidental, as well as large volume blunt trauma, including labor and industry accidents, motor vehicle crashes, boating accidents, mountaineering accidents, plane crashes, animal attacks, given the surrounding natural resources. You name it, we see it. So there's a lot of access to trauma and lots of opportunity there. It is also a center of excellence for stroke. It was the first JACO accredited comprehensive stroke center in the region, and it remains one of the busiest. It's a neurosurgery referral center. It's an orthopedic trauma referral center and a referral center for critically ill patients. Now, many of you may be scratching your head and saying, wait, what do you mean by a referral center for the critically ill patients? Doesn't every hospital have a critical care unit? And you're right. But Harborview, as well as the University of Washington Medical Center, are viewed by the region, both locally and the larger surrounding region, as the place to send the most critically ill patients. And if those critical access or rural hospitals or even community hospitals, if they outstrip their resources, either due to the number of or the volume of the critically ill patients, or perhaps there is a critically ill patient where they don't have the expertise to handle, they'll send those patients to us, either to Harborview or the University of Washington Medical Center. We are also an ECMO center and have an ECMO transport program through Airlift Northwest, the development of which was actually led by one of our own emergency medicine faculty. So you will get exposed to a very large number of critical care patients and critically ill patients, whether it's in the emergency department or on your critical care rotations. And it's important to note, and you will find this out when you view the other videos and talk to our residents and faculty, that critical care is a very strong emphasis of this program and a really important part of your education. Now, 2 other notable facts about Harborview are that it serves an important role in disaster preparedness and disaster management for the region. You may not have this as a primary interest, but disaster preparedness and response is a really important aspect of your education as an emergency physician. It is critical that you gain an understanding and skills in this area. The state of Washington is actually broken down into regions, and each region has its own what's called a Disaster Medical Coordination Center, or DMCC. And Harborview is the DMCC for the busiest part of the state, which is Seattle and King County. So if there's a mass casualty incident or some other disaster, I don't know, a pandemic occurs or something, the DMCC is then activated. And when that occurs, you as the resident may be the individual in the radio room, in the emergency department, with an attending, with a registrar and a nurse manning the radios and the computers. You are part of that team that is in contact with the scene, with EMS, as well as the other hospitals in the region, assessing their bed status and their capacity to take patients. You're getting the status of the scene from EMS, and then you're distributing that information to both the people in the Harborview ED as well as to the other hospitals in the region. And then ultimately, you are actually responsible for distributing and coordinating and triaging those patients. Now, Harborview will take the first 10 to 12 reds or most critical, but then you start to distribute amongst the other hospitals. And of course, you'll learn and you will learn how to manage such a disaster. Now, of course, you will also learn these principles through drilling and formal curricula as well, because this is a core to what we do as emergency physicians. But it's really a great opportunity to learn about disaster preparedness, disaster management in the moment, as well as the resiliency that must follow and that you have to pay attention to after a disaster occurs. Now, lastly, is that Harborview also has a strong role in what is called the Washington Medical Coordination Center, or the WMCC. The WMCC is a relatively new entity that was stood up during the pandemic because of the need to distribute resources across the larger region, the state. And so this was stood up and in fact still exists and functions to identify and assist in appropriately distributing patients in times of scarcity, as well as increasing awareness and coordination and addressing other resource shortages. Of note is that the founding medical director of the WMC is actually one of our own emergency medicine faculty. So again, lots of opportunity to engage with people that have expertise in disaster preparedness and disaster management. Finally, one additional noteworthy comment about Harborview is that by centering all of these areas of excellence or programs at Harborview, this also enables us to leverage care and resources that we otherwise might not be able to leverage for the most vulnerable patients, and to really wrap these services around them. If you think about it, to be, such a busy trauma center or comprehensive stroke center and neurosurgery referral center, all of these, that doesn't require just great physicians and nurses, right? That also requires that we have great physical therapy, occupational therapy, social workers, psychologists, physical medicine and rehabilitation, case manager, all kinds of resources, lots of social work. And so we have access to those resources, and so now do our most vulnerable. So really, again, it's a really wonderful place to work because you can serve this population in a much more effective manner with critical resources that otherwise may not be available to them. All right, so let's talk a little bit about the University of Washington Medical Center. You will spend a significant amount of your time there. This is a tertiary quaternary care center. It's a wonderful place to work. You can see that it sits on the shores of Lake Washington, just on the south end of the larger University of Washington campus. The University of Washington Medical Center, UWMC, provides specialty care for mission areas, including cardiology. It has a really large mechanical circulatory support service, including a very large patient population who have LVADs. UWMC also provides care to a very high-risk obstetric population and has a busy neonatal intensive care unit with some of the most critically ill infants in the nation. They have a very large and complicated hematology and oncology patient population, organ and bone marrow transplant. So really an amazing place to work and learn because of all of this. In the ED, obviously, again, you're going to see the sickest of the sick and the highest acuity patients. You will see lots of critical care there. And again, critical care is a very strong emphasis of our program. In fact, you're going to be doing 2 months of critical care, medical ICU time there, and Dr. Greenberger will talk to you about that. Now, because of where the emergency department is located, again, it is a really fun place to work because of the mix of patients. As I said, it's at the south end of the campus, but then surrounding it is the Husky Stadium that's right across the street. And then most notable, you are surrounded by the community that actually works at the University of Washington. Those people, those citizens, those people in the community that work for Boeing or Google or Microsoft or Amazon and all of the other businesses in the area. So in the emergency department at UW, you will see a really great mix of the sickest of the sick, high acuity patients in cardiology or OB and oncology, But then you're going to see all of that other garden variety emergency medicine coming from the surrounding community, whether it's, minor or moderate trauma, garden variety STEMIs and strokes, a dislocated shoulder. You'll just walk from room to room. One room, you'll have a patient in VFib with an LVAD, but they're talking to you. In the next room, you'll have a patient with a dislocated shoulder or a laceration. So really fun and stimulating place to work and learn. Can be challenging, rewarding, just a great experience. Now, another significant and an essential aspect of your training will occur at Seattle Children's Hospital. And like critical care, pediatrics is another emphasis within the program. Seattle Children's Hospital, of all the children's hospitals across the country, actually serves the largest region. Again, we're talking about the WWAMI region. It is the only children's hospital in the city of Seattle. The next closest children's hospital is down by Tacoma. It's about 35 miles south of Seattle, and it is largely a community-based hospital. It is not a tertiary quaternary care center. And other than that, there are no other children's hospitals in the state of Washington. Again, because of the community it serves, the large growing city and the region, you will see the most critically ill children there at Seattle Children's. And you'll spend time in their pediatric ICU learning critical care medicine, as well as seeing those critically ill patients in the emergency department. And again, a wonderful mix of patients in the emergency department because of the variety you see. You will see the everyday pediatric emergencies from the local community, as well as those truly complex and critically ill from the local community and the large referral region. Now, major pediatric trauma does go to Harborview. You will see that there. But at Seattle Children's, you will see minor and moderate trauma as well. All of their attendings are part of the University of Washington and, of course, are pediatric emergency medicine trained. Of interest to you, though, may be that Seattle Children's actually supports a pediatric emergency medicine fellowship, which is top ranked. They accept a mix of pediatric and emergency medicine trained fellows. So if you have an interest in pediatric emergency medicine, this is a great time to sort of dip your toe in the water. They take 3 fellows per year, and they're really an amazing group. In fact, some of their fellows, the fellows who were previously pediatric trained, will do rotations at Harborview and the University of Washington emergency departments in order to get experience in adult emergency medicine. I think it's also important to note a really nice thing is that we have really a great collaboration with the pediatric emergency medicine faculty. It's not like you're going over there and they don't know our faculty and they don't know about our program. It's not like you're just guests there. You are really fully integrated there. As I said, all of their faculty are University of Washington faculty. They're wonderful. They embrace our residents. And in fact, from the start, they actually offered and have been supporting the pediatric portion of our didactic conferences. We work very closely with their faculty on many levels. We have a lot of collaboration with them, of course, through medical education and clinical care, but also through some research and QI projects as well. So lots of opportunity there. And in fact, we actually have 4 faculty who are pediatric and emergency medicine trained, and they spend a portion of their clinical time at Seattle Children's and then a portion of their time at the University of Washington Medical Center or Harborview. So again, really seamless collaboration, creating some great opportunities for our residents and our pediatric in pediatric emergency medicine. Valley Medical Center, another really critical aspect of your training, and you will spend several months there in their emergency department. You'll spend a month there in your 2nd, your 3rd, and your 4th year of training. Valley is a community hospital. It's part of UW Medicine. It's located about 10 miles south of Harborview. And again, this is where you will get your community-based emergency department training experience. It is a very busy community hospital with a volume of somewhere between 85 to 90,000. And notable is that about 15% of that volume is pediatrics. So another great opportunity to hone and emphasize those pediatric skills. They have a relatively new emergency department. So very nice place to work from that perspective, from the perspective of the amenities. They are a level 1 cardiac center, a level 2 stroke center, and a level 3 trauma center. They have a clinical pharmacist 12 hours a day. This is just details. It's also a reminder to me to tell you that actually we have a pharmacist 12 hours a day at all of our clinical sites, and they add tremendously both to patient care as well as education for our residents and our faculty. Valley has a very busy OB service. You will have an opportunity to spend a month there delivering babies and learning and treating patients with pregnancy-related emergencies, which obviously is really important to what you do. So that's sort of a high-level overview of the clinical training that we provide to our residents. Again, the videos from Dr. Greenberger, as well as some of our other faculty and our residents, provide greater curricular detail and give you a better feel. I should mention there is also opportunities for a rural experience. And again, Dr. Greenberger will share that with you. But I want to stop here for just a second to make a few really important points. Many of you may be saying to yourself, well, why do I need to work at all of these 3 sites? Seattle Children's is obvious. It's obvious why you need to work there. But why do I have to work at both Valley, University of Washington Medical Center, and Harborview? You may be thinking, I know I want to work in a safety net hospital like Harborview, a county hospital. Or, so why do I need to work at the University of Washington Medical Center in Valley? Why don't I just do all my time at Harborview? Or you may be thinking, I want to work at a community site. So why do I need to work at Harborview or in the University of Washington Medical Center? I'm not really, I'm going to be in a community. What do I need to know about LVADs? What do I need to know about checkpoint inhibitors for cancer patients? What do I need to know about transplant medicine? You may be thinking again, I don't want to go into cardiology. So what do I need to know about these things? Again, especially because I'm going to work at a community site. Well, there are a few reasons for this, and I'm going to make a case for why I think it's important. And so, first of all, I want you to think back to what we said our stated goals were as a program, as well as what our commitment and our goals for you as trainees were. Remember, our goals were to train emergency physicians who are outstanding and can go out and can practice anywhere and see anyone. And that was the goals for our program, right? And our goals for you are to prepare you to do that so that you have choice. Above all, we want you to be obviously excellent emergency physicians, but we want you to be happy and thriving wherever you're practicing. Well, the only way that we can prepare you to practice in any site and to see anyone is to make sure that you have spending time in your training at those types of sites, in those types of settings. Now, you may be saying, well, why is that? Medicine's the same. The pathophysiology, the pharmacology is the same at each site. That doesn't change with geography. And that's true. You would be correct in saying that. But the systems-based practice is very different, which does require different skills and approaches to your practice and the delivery of emergency care. Practices look very different, and it feels different in these varied settings. So, for example, at Valley, you're going to be pushed to be very efficient. You'll have a lot of resources at your fingertips right there in the emergency department. You might have people going in and really preparing the laceration for you and having everybody set up, everything set up for you. Throughput is faster there, and you'll be expected, because of those additional resources, to keep up with that. Often in a community hospital, it is a physician that's actually the rate limiting step in keeping things moving, versus in an academic health center or a county system where throughput is perhaps not quite as quick, and patients are much more complex. The system limits you a bit, both the system and the complexity of the patients. In the academic or the county setting, you will need to learn to manage a much more complex set of resources and challenges, and you'll need to learn to prioritize a little bit differently. These are all important skills. Admitting a patient is very different at each of these sites. Discharging is different, and these different processes and resources lead to different safety and quality issues that you need to consider in your disposition decision-making, for example. You really need to learn what that's like, learn the differences, and learn how to function in these very different settings with very different levels of resources. A community hospital like Valley doesn't have the capacity to handle, or may not have the capacity to handle a large number of critically ill patients at once. Maybe you in the emergency department can, but their ICUs may not be able to. They may not be able to mobilize ORs as rapidly as we can at Harborview. They do not have some of the same specialty care needed for patients. So as an emergency physician practicing at a place like Valley, you need to learn how to identify those patients in need of transfer and how to do so efficiently and safely. When is the patient stable enough for transport? What do I need to do to stabilize them prior to transport? You need to learn how to determine and make decisions around system capacity at that institution and when it might be overwhelmed. You will be asked to prioritize patients for transfer versus admission at that site. And you will then need to communicate efficiently with the hospital to which you are transferring the patient. You need to ensure there is an adequate handoff and transfer of data and information so that it's a safe transition of care. You may need to determine if ground versus air transport is necessary. These are all learned skills. At Valley, if you get a type A dissection, you're going to have to figure out, what do I need to do really quickly to get them to Harborview or to, in that case, to the University of Washington Medical Center. Again, these are all learned skills. Now, versus at Harborview as an example, where you will be taking the phone call from the transferring hospital, and you may find yourself actually coaching an individual, a physician or other practitioner at a rural or critical access hospital, as to how best to stabilize a patient for transport. You'll learn how to garner the information you need from those conversations to determine if transfer is safe, if the patient is stable enough for that, or determine if they need a helicopter versus a ground transport, or maybe coach that person, figure out whether you need to coach them to intubate or put in a chest tube or put a patient on pressors prior to transport. These are very different skill sets and roles, and they're all very important. So very different system-based practices, all of which are important to learn. So that's reason number one for this broad-based clinical exposure. And that is truly the only way to prepare you to practice anywhere and really to see anyone. Now, just as important as a variety of sites is a variety of patients and injury and illness, or a variety of patient presentations or pathologies that you see. Again, while you may be thinking, I don't want to go into cardiology, why do I need to know about an LVAD? Well, here's what you need to consider and understand. When patients come to a place like the University of Washington Medical Center, for example, from their communities, from 50, 100, sometimes 200 or 300 miles away, sometimes even further than that, they come with their complex diseases for really specialty care. But they don't come to stay or move to Seattle, right? And our goal really is to improve their health so that they actually can enjoy as best a quality of life as possible, but back in their own home community. So let's say they undergo a liver transplant, or they have placement of an LVAD, or they are a complex patient and they get placed on a complex hematology oncology patient that gets placed on a checkpoint inhibitor or some other new immunosuppressive drug. When those patients, they go back to their community, they get better enough to go back to their community. But when they get sick, when their LVAD, for example, malfunctions and they come into your emergency department feeling weak and dizzy, or they have a reaction to their checkpoint inhibitor, or develop abdominal pain after their liver transplant, they're going to come into your emergency department and they will seek initial care in your department. And you, as that emergency physician, you need to know how to diagnose and care for that patient. And there is no better way to do that than to learn at a place like the University of Washington Medical Center that provides you with adequate exposure to these patients, be it in the ED or ICU rotations. From those experts, you will learn from those experts who manage these patients and really know, they are experts in these areas. And you can make that case for trauma and so many other patient presentations. Exposure to adequate volume and variety and breadth of emergency medicine is really essential to your education. Now, finally, there is a third reason that we so deliberately provide such a broad range of training opportunities. And that's really simply aimed at the well-being and long-term success and happiness of you, our trainees. Our wish, again, for our trainees is that they thrive and are fulfilled both on a professional and personal level, of course. And an important part of that is being able to identify which practice setting is most compatible with your goals, which setting fits you most. The only way to determine that is to ensure adequate exposure and experience in all of these sites. Many of you, as I previously said, may be thinking that you are absolutely clear as to how you envision your emergency medicine practice. You may be thinking, I know that I want to be in an accounting setting, or I know I want to teach, or I know I want to be in a community setting. But let me share with you some real conversations I've had and real examples. I'm sitting with the third-year resident, and we're reviewing their CV in preparation for their job search and discussing various opportunities and what next best steps for them might be. And again, I'm looking at job opportunities within the community. And as I review their personal statement or my interview notes from 3 years ago, it indicates a strong interest and, in some cases, strong statements with assuredness that they will be seeking and practice in an academic setting, and they want to teach. Yet somehow, again, I'm finding myself discussing community practice options with them, or vice versa. Perhaps they had indicated that they wanted to be in a community setting, and now we are talking about fellowship opportunities and opportunities in academic medicine. So it seems they've changed their minds. And boy, that's happened a lot. And you know what? That is really a good thing. And that's okay. That means that we gave you the opportunity to do that self-exploration, to really figure out what it is you want to do, both from the perspective of how you want to practice, the type of setting you want to practice in, and through that career development pathway. This is the curriculum that means that our curriculum allowed you to really, truly understand the many opportunities across the specialty of emergency medicine, including the different practice specialties which fit you best. So that when you make that next decision, which is a big one, you're really informed. Because again, above all, we want you to be certainly great emergency physicians, but we want you to be happy and we want you to thrive. And the best way to do that is to get the opportunity to truly explore all of these different practice environments. Most of you have done 2 rotations, some 3. That's really a sliver of emergency medicine. Now is the time for you to really experience it, learn about it, and figure out what it is that's going to make you happy. And we want to provide you with that opportunity. So this is why we've been so deliberate and thoughtful in developing and implementing a curriculum with such broad-based and in-depth training in emergency medicine. We believe it is critical for your future patients, critical to achieve our goals and mission, and critical for your success and well-being that our trainees are exposed to a breadth and variety of patients and their presentations, and exposed to a variety of clinical settings. I would simply add again that this is the why for our 4-year program. Now, I'm going to talk to you about 2 more resources, Airlift Northwest and Seattle King County Medic One. These 2 resources are absolutely pivotal to our longitudinal EMS curriculum. And while you may not want to pursue a career focused in EMS, as an emergency physician, you obviously need to know about the principles and have practical knowledge and skills within EMS. You need to understand EMS capabilities, effective ways to interact with the EMS system, how to provide education and feedback to EMS providers, and of course, how to use these resources appropriately. So Airlift Northwest is the air medical transport program of UW Medicine. We cover a very vast region, essentially the WWAMI region. We have bases up in Juneau, Alaska, on the peninsula of Washington State, up and down the I-5 corridor on the east side of the state. We have both fixed wing and rotary aircraft. Airlift is one of the busiest systems in the country. And as I had mentioned earlier, we just implemented an ECMO retrieval service. So we fly very sick patients, and this is a great opportunity for learning. The medical director and the associate medical director for Airlift are, of course, one of our emergency medicine faculty. And through this curriculum, you will learn the principles of air medical transport, including flight physiology, how best to use this resource, where does it fit in the system of care or the chain of survival, How can it best be leveraged for our patients? You'll learn principles of QA and QI related to air transport. You'll have the opportunity to learn from incredibly experienced flight nurses, as well as the opportunity to teach them. If you want to make this part of your career development pathway, we have a structured pathway for that, and you can become what we call a resident associate air medical director. While a resident in the program, you will have the opportunity to fly, but we do not require it. So I would encourage you to look at the section of a section of EMS within our website, and maybe look at there's a video, and I believe there will be a webinar. Now, another important part of your EMS training is focused in ground EMS. We have a close working relationship with Seattle Medic One, which is one of the finest EMS programs in the country, if not the finest. So you will really learn from the best of the best. The medical director for Seattle Medic One is one of our emergency medicine faculty, Dr. Michael Sayre, and he's internationally and nationally known for his work in pre-hospital care, as well as in cardiac arrest resuscitation, among other areas. So again, you're going to learn how to interface with ground EMS. You'll learn about medical control, principles of education for paramedics, QA, QI, among other topics. You will have the opportunity to work alongside some outstanding paramedics, but you will also have the opportunity to train the paramedic students and to teach the paramedic students. We have a world-renowned paramedic training program. It's housed within the Department of Emergency Medicine, and this is a wonderful opportunity for you to, again, interface with EMS, hone your teaching skills, dip your toe in the water to see if this is something you want to do long-term. And again, you can make ground EMS or a combination of ground and air EMS your career development pathway. You can function as a resident associate medical director for one of the paramedic stations. So really an amazing opportunity for you to learn. So the question is, with all this, is all of this, what I just described, enough to make a great training program? And the answer is it's almost there, but not quite. You also need those people who are going to be fully invested in you and in your education and career development, as well as those individuals who are advancing and shaping the future of emergency care, who are the change makers and leaders of the specialty. Those people who really want to train you, embrace you, mentor, and guide you. And they must be committed to do so in the everyday training in the ED, as well as in relation to your career development. So if you ask me, what are the strengths of our program? What gets you up in the morning? What do you love? What are you most proud of? Questions like that. The answer is always the people. It's not the bricks and mortars, that's for sure. We have an amazing faculty group. They come from all over the country. We're not inbred as a department. Our faculty are fellowship trained in an array of specialties and are leading the way as change makers in so many areas. They are creating and shaping the future of emergency care, whether it's in EMS, critical care, population health, resuscitation science, you name it. And so if you have an interest in any of these areas, to just name a few, there are lots of others. There are opportunities for you here at the University of Washington to dive right in and to engage and explore. And our faculty are eager to have you jump in. Perhaps what is most exceptional about the faculty, beyond how bright they are and their commitment to excellence, is their commitment to our trainees and to the program. Now, I want to share one more thought about what makes the University of Washington such a special place, and that is the spirit of collaboration. This is a statement that I took from the University of Washington website. There was a project that was ultimately named the Portfolio of Possibilities that actually ended up being an investigation into the relationships between art and technology. It engaged students and faculty from the School of Art and History, from mechanical engineering, from applied math, and then even from atmospheric sciences, an unusual collaboration, one might say. And in an article highlighting the project or the work that they did, one of the faculty said it's this culture of collaboration beyond traditional boundaries that infuses our work and with almost endless possibility. And that is so true of this institution, making it such a rich place for education, clinical care, and for research. Our faculty and our department have collaborations across so many areas, both within and outside the School of Medicine, whether it's with psychiatry, surgery, pediatrics, urology, global health, the School of Public Health, bioinformatics, mechanical and bioengineering, the Applied Physics Lab, to name only a few. It's in part this collaboration that really enriches our work and creates so many opportunities for students, for trainees and faculty, and for our patients. So thank you for your interest in our program. I hope that you take the time to view other videos and all of the other resources and learn about the many opportunities available to our trainees. I wish you the best of luck in the match and in your careers. You are joining the best specialty in medicine.